You want to know the real reason most people never get their blood sugar under control? It's not because they don't care. It's not because they're not trying. It's because they've been told the only real solutions are medications, endless restrictions, and living in fear of every single thing they eat. And that's just not true. What if I told you there are 3 plant leaves, ordinary, accessible, kitchen-friendly leaves, that can help regulate your blood sugar, improve your insulin sensitivity, and support your vascular health in ways that most doctors never mention? And what if I told you that people have been using these for centuries, that the science backs them up, and that you can start using them today without spending a fortune or turning your life upside down? I'm Dr. Sarah Wilson, and I've spent over 30 years helping people take control of their metabolic health. I've seen thousands of patients stuck in the same exhausting cycle: high blood sugar, insulin resistance, fatigue, medications that barely move the needle, and a constant feeling of being overwhelmed. But I've also seen people break free from that cycle by understanding how food works at the cellular level and by making small, strategic changes that compound into real, lasting results. Today, I'm going to share 3 plant leaves with you that can change the game. And I'm not talking about exotic supplements or expensive extracts. I'm talking about bay leaves, guava leaves, and mulberry leaves. Real, whole, accessible foods that work with your body's natural processes to help you stabilize your blood sugar, protect your blood vessels, and feel better every single day. Now, before you click away thinking this sounds too simple or too good to be true, stay with me. Because I'm going to walk you through exactly how each of these leaves works at the cellular level, what the research says, how to use them safely and effectively, and the mistakes people make that sabotage their results. I'm also going to share real stories from real patients so you can see what's possible when you give your body the tools it needs. This isn't about replacing your medications or ignoring your doctor's advice. This is about adding a layer of support that most people don't even know exists. Let's start with bay leaves. And I'm not talking about the dried bay leaves you throw into a pot of soup and fish out before you eat. I'm talking about using bay leaves intentionally, strategically, to support your metabolic health. Bay leaves have a nutrient profile that most people'd be shocked to learn about. They're high in fiber, which slows down glucose absorption. They contain minerals like magnesium and manganese that are critical for insulin signaling. And they're loaded with polyphenols, which are plant compounds that reduce inflammation and oxidative stress. Here's what happens at the cellular level when you consume bay leaves regularly. The polyphenols in bay leaves improve insulin receptor activity. That means your cells become more responsive to the insulin your pancreas produces, which means glucose gets pulled out of your bloodstream more efficiently. Bay leaves also contain compounds that slow down the enzymes in your gut that break down carbohydrates, which means sugar enters your bloodstream more gradually instead of spiking all at once. And on top of that, bay leaves reduce arterial inflammation, which is one of the main drivers of cardiovascular disease in people with metabolic issues. Studies have shown that people who consume bay leaf tea regularly have lower fasting glucose, better post-meal glucose control, and improved LDL cholesterol levels. And the effects aren't subtle. We're talking about measurable, clinically significant changes. How do you use bay leaves? The simplest ways to make a tea. Take 3 to 4 fresh or dried bay leaves, crush them slightly to release the compounds, and steep them in hot water for about 10 to 15 minutes. Drink this tea once or twice a day, ideally about 20 to 30 minutes before meals. The timing's important because you want those polyphenols and fiber compounds in your system when the food arrives so they can slow down glucose absorption. You can also add bay leaves to stews, soups, and broths, and actually consume the softened leaves if they're cooked long enough. Some people make a lemon bay infusion by steeping bay leaves with lemon slices and a cinnamon stick, which adds extra polyphenols and makes it taste better. Let me tell you about a patient named Eleanor. She's 67, came to me with a fasting glucose that was consistently in the 150s and post-meal spikes over 200. She was on medication, but her numbers weren't improving. We added bay leaf tea twice a day, 30 minutes before lunch and dinner. Within 3 weeks, her fasting glucose dropped to the 130s. By 2 months, her post-meal spikes were under 180. Her doctor was stunned. She said she felt more energetic and less bloated, and she'd lost 7 pounds without changing anything else. That's the power of bay leaves working at the cellular level. Now let's talk about guava leaves. Guava leaves are incredibly nutrient-dense. They're high in protein, complex carbohydrates with a low glycemic impact, fiber, vitamin C, potassium, and some of the most potent polyphenols you can find in any plant. These polyphenols improve endothelial function, which is the health of the inner lining of your blood vessels. When your endothelium's healthy, your blood vessels can dilate and constrict properly, blood flows efficiently, and your risk of vascular damage goes way down. Guava leaves also improve lipid balance, which means they help lower bad cholesterol and raise good cholesterol. And they've got powerful antioxidant properties that reduce oxidative stress in your cells, which is a major driver of insulin resistance. Here's what happens when you consume guava leaves. The polyphenols inhibit enzymes like alpha-glucosidase and alpha-amylase, which are the enzymes that break down carbohydrates in your gut. When those enzymes are slowed down, glucose enters your bloodstream more gradually. Your pancreas doesn't have to release a massive surge of insulin. And over time, your cells become more sensitive to insulin because they're not constantly being flooded with it. Studies have shown that guava leaf tea can lower fasting glucose by 15 to 20% in people with prediabetes and type 2 diabetes. It also improves insulin sensitivity and reduces inflammation markers like C-reactive protein. How do you use guava leaves? You can make a tea the same way you do with bay leaves. Take about 5 to 7 fresh or dried guava leaves, crush them slightly, and steep them in hot water for 10 to 15 minutes. Drink it once or twice a day, ideally before meals. You can also make a lemon cinnamon guava infusion by adding lemon slices and a cinnamon stick to the tea, which boosts the polyphenol content and improves the taste. Some people cook guava leaves in vegetable broths and consume the softened leaves as part of the broth. If you're finding this helpful and you want to learn more practical, science-backed strategies for managing your blood sugar naturally, go ahead and hit that subscribe button and give this video a like. I create content to help you take control of your metabolic health without relying solely on medications, and I'd love to have you here learning with me. Let me tell you about a patient named Vincent. He's 73, had an A1C of 8.4, and was struggling with fatigue, brain fog, and poor circulation in his legs. His doctor had added a second medication, but Vincent wanted to try something natural alongside it. We started him on guava leaf tea twice a day, before lunch and dinner. Within a month, his fasting glucose dropped from the 170s to the 140s. By 3 months, his A1C was down to 7.2. He said his energy was back, his brain fog was gone, and he could walk farther without his legs aching. That's guava leaves improving insulin sensitivity and vascular function. Now let's talk about mulberry leaves. Mulberry leaves are absolutely fascinating because they contain a compound called DNJ, which stands for 1-deoxy-no-germicin. DNJ's a natural alpha-glucosidase inhibitor, which means it slows down the breakdown of carbohydrates in your gut in a very specific way. When you eat carbohydrates, enzymes in your small intestine break them down into simple sugars that get absorbed into your bloodstream. DNJ blocks those enzymes, which means the carbohydrates you eat get absorbed more slowly and your blood sugar doesn't spike as high. This is actually the same mechanism that prescription medications like acarbose use, but mulberry leaves are a natural source. And on top of DNJ, mulberry leaves are high in protein, fiber, minerals like calcium and iron, and antioxidants that reduce oxidative stress and improve lipid profiles. Studies have shown that people who consume mulberry leaf tea before meals have significantly lower post-meal glucose spikes. We're talking about reductions of 30 to 40% in some cases. And over time, regular consumption improves insulin sensitivity and can even help lower A1C. How do you use mulberry leaves? Same method, make a tea. Take about 5 to 7 fresh or dried mulberry leaves, crush them, steep in hot water for 10 to 15 minutes, and drink it 20 to 30 minutes before meals. You can also make a mint lemon mulberry infusion by adding fresh mint leaves and lemon slices, which makes it refreshing and adds extra polyphenols. Some people cook mulberry leaves in vegetable broths or add them to soups. The key with mulberry leaves is timing. You want to drink the tea before you eat so the DNJ's already in your system when the carbohydrates arrive. If you drink it after the meal, you've missed the window. Let me tell you about a patient named Dorothy. She's 64, had post-meal blood sugar spikes that were routinely over 250, even though she was being careful about what she ate. Her doctor was talking about adding insulin. Dorothy was terrified. We started her on mulberry leaf tea 30 minutes before each meal. Within 2 weeks, her post-meal spikes were under 180. By 6 weeks, they were consistently under 160. Her A1C dropped from 8.1 to 7.3 in 3 months. She avoided insulin. She said she felt like she'd gotten her life back. Now, let me tie all 3 of these leaves together for you because they work in complementary ways. Bay leaves improve insulin receptor activity and reduce inflammation. Guava leaves support endothelial function and lipid balance. Mulberry leaves slow carbohydrate digestion and blunt post-meal spikes. When you use all 3 strategically, you're addressing multiple aspects of metabolic health at the cellular level. Here's a simple daily plan you can follow. Morning, 20 to 30 minutes before breakfast, drink a cup of mulberry leaf tea. This'll blunt the glucose spike from your breakfast. Mid-morning or early afternoon, drink a cup of guava leaf tea to support your vascular health and insulin sensitivity throughout the day. Evening, 20 to 30 minutes before dinner, drink a cup of bay leaf tea to improve insulin signaling and reduce inflammation. That's 3 cups of tea spread throughout the day, each with a specific purpose. You can rotate them too. Some days you might do mulberry before all 3 meals. Other days you might do guava in the morning and bay at night. The key's consistency. Your body needs these compounds regularly to build up and maintain their effects. Now let me give you some important cautions because safety matters. First, these leaves are food, not medicine. They're meant to complement your medical care, not replace it. If you're on diabetes medications, especially insulin or sulfonylureas, you need to monitor your blood sugar closely when you start using these leaves because they can lower your glucose. You don't want to go too low. Work with your doctor to adjust your medications if needed. Second, start with small amounts and see how your body responds. Some people experience mild digestive upset when they first start drinking these teas. If that happens, reduce the amount and build up gradually. Third, if you're pregnant, nursing, or have kidney disease, talk to your doctor before using these leaves. There's not enough research on safety in those populations, so it's better to be cautious. Fourth, don't overdo it. More isn't always better. Stick to the recommended amounts: 3 to 7 leaves per cup of tea, 1 to 2 cups per day per type of leaf. Drinking excessive amounts can cause digestive issues and won't give you better results. And fifth, buy high-quality leaves. If you're using dried leaves, make sure they're from a reputable source and haven't been treated with pesticides or chemicals. Organic's always better if you can find it. Here's what you can expect if you use these leaves consistently. Within 1 to 2 weeks, you should notice more stable energy throughout the day. You won't have those dramatic crashes after meals. Within 3 to 4 weeks, your fasting glucose should start to improve. You'll see lower numbers in the morning. Within 6 to 8 weeks, your post-meal spikes should be noticeably reduced. And within 3 months, if you get an A1C test, you'll likely see improvement there too. But beyond the numbers, you'll feel better. Your energy'll be more stable. Your brain fog'll clear. Your cravings''ll decrease. Your digestion'll improve. Your sleep might even get better because stable blood sugar supports better sleep quality. Let me tell you about one more patient. His name was George, 78 years old, had been living with type 2 diabetes for over 15 years. His A1C was 9.2, he was on 3 medications, and his doctor was talking about adding insulin. George was exhausted all the time, couldn't think clearly, and felt like he was just waiting for things to get worse. We started him on a rotation of all 3 teas: mulberry before meals, guava midday, and bay in the evening. We also cleaned up his diet and got him walking 20 minutes a day. 6 months later, George's A1C was 7.4. His doctor was able to reduce one of his medications. His energy was back. He could think clearly. He was walking his dog again, gardening, enjoying time with his grandkids. He told me he'd given up hope, and these 3 leaves, along with the other changes, gave it back to him. Here's the bigger picture I want you to understand. Metabolic health isn't just about medications and restrictions. It's about understanding how foods work at the cellular level and using that knowledge to support your body's natural processes. Bay leaves, guava leaves, and mulberry leaves aren't magic. They're not going to cure diabetes. But they're powerful tools that can help you stabilize your blood sugar, improve your insulin sensitivity, protect your blood vessels, and feel better every single day. And they work best when they're part of a comprehensive approach. That means balanced nutrition with plenty of protein, fiber, and healthy fats. That means regular movement, even just walking. That means quality sleep. That means managing stress. That means staying connected with your healthcare team and monitoring your progress. These leaves are one piece of the puzzle, but they're an important piece that most people don't even know about. The core message I want you to take away is this: you have more control over your metabolic health than you've been led to believe. You're not helpless. You're not stuck. You just need the right information and the right tools. And these 3 leaves are tools that have been used for centuries, that are backed by modern science, and that you can start using today. Small, consistent choices yield meaningful health improvements. 1 cup of tea at a time, 1 meal at a time, 1 day at a time. You don't need perfection. You just need progress. If you found this helpful, I want to hear from you. Drop a comment and tell me your name, your age, and which of these 3 leaves you're going to try first. Tell me where you're watching from. Share your experiences with blood sugar management, what's worked, what hasn't, and what you're struggling with. And please, hit that like button and share this video with anyone who's dealing with metabolic issues or who wants to support their health naturally. Also, I really want to know what topics you want me to cover next. What are you struggling with? What questions do you have about diabetes, blood sugar, insulin resistance, nutrition, supplements, medications, whatever it is? Tell me in the comments. I'll do my research, dig into the science, and make a video on it. Your input helps me create content that's actually useful and relevant to your life. Together with balanced nutrition, movement, sleep, and healthcare guidance, bay leaves, guava leaves, and mulberry leaves can support fasting glucose stability, reduced post-meal spikes, improved insulin sensitivity, and healthier vascular and metabolic function. They're evidence-informed complements, not cures or replacements for medical treatment, but they're powerful, accessible, and effective. Progress over perfection. Small, consistent choices. Real food, real science, real results. I'm Dr. Sarah Wilson. See you in the next video.